I'm Walter Baile, and I'm from the MD Anderson Cancer Center, where most of my effort is dedicated to teaching oncology trainees and other people to improve their communication skills with patients and family members. Shared decision-making is a relationship between the physician or the healthcare provider and the patient and family member. It's a very complex communication task on the part of the oncologist because it involves a number of communication strategies or steps, ranging from establishing a rapport with the patient and the family, to inviting the patient to consider participating in shared decision-making, to presenting the treatment options, to helping patients make the choice, and to formulating a treatment plan. Because this is complicated, that it requires fairly intensive and somewhat sophisticated training. And there are a number of models out there to help oncologists and other providers do this. The most effective one, and really the gold standard, being using simulation with standardized patients or actors, in which the actors may take the part of patient or family members, and the oncologist practices inviting the patient to participate in shared decision-making and the other tasks involved in coming to a decision about what treatment may be best for the patient and family. So first, there are guidelines which the oncologist or the other healthcare provider need to be aware of. And then there is the practice, and then there's the feedback. So this is a task in which people have a roadmap of how to do it. Then they get to practice the actual process of trying it out, and they can stop and start when they get stuck with a coach who actually will help them go through the process of shared decision-making in a way that they don't become embarrassed or they don't become de-skilled, but at the same time offering suggestions and allowing people to do it over again when they don't get it right the first time. So this is a simulation, and it simulates what might happen in an office setting in a safe way and an effective way that people can try it over again until they're satisfied that they've got it right. And also, in this way, they get feedback from the standardized patients as to how they're doing, what made a difference to the standardized patient in terms of the words they use and the phrases and the degree of involvement and the rapport. So this is a process really based upon a simulation in which people get to try things out, and this builds confidence and it builds competency in a way that one can then bring it into the clinical setting and try it out.